town meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Colby.
Here.
Mrs. DeFlorio.
Here.
Ms. Hasman.
Here.
Mr. Hebert.
Here.
Ms. Lamar.
Here.
Mr. Lee is excused. Mr. Marionetti.
Here.
Chairwoman Taylor.
Here.
Mr. Udelson.
Here.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up, who would like to speak and address this committee at this time? Seeing none. The next business is the approval of the minutes. The next item on the agenda is the approval of the minutes. You have the September 28th, 2021 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 21-0370, acceptance of 2 grants from the New York State Department of Health for support of the Monroe County Nurse Family Partnership Program, and amend Resolution 270 of 2021 to amend and increase the contract with Community Care of Rochester, doing business as Visiting Nurse Signature Care.
Move, Madam Chair.
Second.
Moved by Legislator Hebert, seconded by Legislator Florio. Is there any discussion? Yes, Legislator Hebert.
Thank you, Madam Chair. Through you to the administration, the 2 grants total a little over $300,000. The increased Community Care of Rochester is a little over $237,000. Where's the additional $63,000 being allocated?
I'm sorry, the 2 grants total approximately $302,000, and the entire amount is being allocated to the NFP program.
Thank you, but I understand through you, Madam Chair, the administration, there is $63,000. The referral specifies a $237,144 increase for Community Care of Rochester for the NFP program. As far as I can tell, it does not specify where the extra $63,000+ is going. That's what I'm asking about, is that $63,000.
Through the chair, I'm not sure where you're seeing that extra $63,000.
Through you, Madam Chair, it's just math. It's just a calculation.
Oh, I'm sorry, through the chair, I'm sorry. There was a miscalculation in the original referral, and approximately $63,000 was included in that amount. It went through multiple checks, nobody noticed it, I didn't notice it, my financial person didn't notice it. But that approximately $63,000 is not available in this year's budget. So it should never have been included in the initial amount. I hope that makes sense.
Through you, Madam Chair, the administration, so will you be amending this referral to make it correct then? Or is it your intent to go forward with an incorrect referral?
Through the chair, the calculation for this referral made a correction, took away that amount of money that's not available in this calendar year. The money we hope will be allocated in next year's budget, but it's not available in this year's budget, and so this referral subtracted that out. That's why the totals don't seem to match.
Through you, Madam Chair, you're still asking us to accept a grant, 2 grants totaling over $300,000, and you're telling me that money is not available. Will you be amending this to fix that problem?
Through the chair, the $300,000 is the money that's available. The incorrect referral was the original one, not this one. This referral actually corrects the miscalculation that was in the original referral.
Through you, Madam Chair, then I'm going to go back to my original question, the $63,000 that is not going to Community Care of Rochester. Where is that going?
Through the chair. That money, when it becomes available in next year's budget, will go to Community Care of Rochester as planned.
Then through you, Madam Chair, just a comment that the referral is then not correct as written, and I would ask you to amend it and make it correct for the full legislature. Otherwise, I don't know how we can pass it. I do have one other question, which is the referral refers to 4 additional one-year terms, and normally the referrals that we've seen is specified to some degree where that money would be coming from. This one does not. You have some idea, through you, Madam Chair, of the administration, where that additional 4 one-year funding streams would come from?
Through the chair. The amount of money, the 200,000, is a continuation of a sum of money that has been granted to us annually for the last several years. Did not come through in the early part of 2021, and that's the reason why it's a 2-year period of time for that 200,000. The $98,000 is American Rescue Plan dollars, and on the award letter, it indicated that it would be continued for subsequent years.
Through Madam Chair, the last comment confuses me. The American Rescue Plan dollars that you just referred to, what entity are they attached to? That should not be part of the county's $144 million change. So where is that money coming from?
Through the chair, that is separate money that's coming through the state health department for this program specifically. It was earmarked for specific, primarily county-run programs, such as the Nurse Family Partnership. 16 counties in New York State are being awarded this money, and we are one of them.
Okay, thank you. One final question, Madam Chair. Will you be amending this, the full legislature, the administration, through you, Madam Chair?
Through the chair, I'm going to take a stab at answering this question. The contract amount is currently, the contract amount with Community Care of Rochester, DBA, is in your signature care, is currently $819,848. What I'm hearing is that contract should have been only $770-something thousand. Back in the original referral, there was a miscalculation, and Community Care of Rochester was awarded a contract too high. Fortunately, these additional grant funds are coming to us, and we are going to increase the contract with Community Care of Rochester, but we have an opportunity to fix the overfunding in the first referral by providing them just the difference in this referral to get them to where they need to be.
Thank you, Mr. Franklin. Through you, Madam Chair. Then could you just summarize that in writing and provide it to us part of the full legislation, so that we have a full understanding of what it is you're asking us to pass?
We will certainly do that. Thank you.
Thank you, Madam Chair.
Any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0371, acceptance of a grant from the New York State Department of Health for the local health department's support for the COVID-19 vaccine response program.
Move it.
Second, Madam Chair.
Moved by legislator Flores, seconded by legislator Colby. Is there any discussion? Legislator Edison?
Thank you, Madam Chair. Through you to the administration, I just wanted to clarify, is this grant retroactive at all or only for the period going forward?
Through the chair, this will be going forward. The budget amounts are not yet approved by the state.
And also through the chair, am I correct in my understanding that this grant is 100% funding? There's no net cost to the county?
Through the chair, that's correct.
Thank you. And then through the chair, I would just like to offer my compliments to the county executive and the administration for the way they've rolled out this response for vaccinations, testing, and the other things needed in the community. Thank you, Madam Chair.
Legislator Weaver?
Thank you, Madam Chair. Through you to the administration, are there other grant requirements in addition to those listed in the referral?
Through the chair, I'm not sure I understand the question. There is like quarterly reporting.
Through you, Madam Chair, let's try the other ones, maybe we'll come back to that. Will this funding be used to supplement existing efforts that are already in place in this area, or are they going to create new solutions?
Through the chair, this will be used to fund staffing and operating expenses going forward to help with the vaccination effort. It may supplement what we're doing now.
Thank you. Through you, Madam Chair, to the administration, is the intent to use this funding during the entire 3.5-year period mentioned in the grant, or is it so will it be spread out over 3.5 years, or is it all going to be used early on, or what is the plan?
Through the chair, the budget is to smooth it at least over 2 years.
Thank you, Madam Chair.
Madam Chair,
Yes, Legislator Coleman?
is this money going to be available not for vaccination or also booster shots if needed? Through you,
Through the
Madam
chair, this is for pandemic response, and so that's the definition of that is pretty broad. The booster shots didn't even exist when this was written, so we're interpreting it that any type of pandemic response is covered. So yes, we would include booster shots, the staff that administer booster shots under this grant money.
Thank you.
Legislator DeFoe?
Through the chair to the administration, so just to clarify, the referral says vaccine response, but you're saying pandemic response. Is it limited to vaccinations and staffing and education specifically for vaccination? Or is it available for use for any of the pandemic response? There's a big difference there.
Through the chair, it is primarily for vaccination. During the vaccination effort, we do offer education about the pandemic and about safety measures, but it is primarily for vaccination.
So, as a follow-up through the chair to the administration, so for instance, it wouldn't be utilized for testing purposes or PPEs or
Through the chair, it could be used for PPE used during the vaccination effort. So anything that we use while we're vaccinating would fall under this. And any education we provide to the patients while we're in that vaccination outreach effort, yes.
understood, but you wouldn't be using it to buy PPEs to give to the towns or.
Through the chair, that's correct. It all has to be linked to vaccination.
Gotcha. Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0372, acceptance of a grant from the New York State Department of Health for the HIV surveillance program.
Move it, Madam Chair.
Moved by legislator Colby, seconded by legislator Marionetti. Is there any discussion? Legislator Victoria?
Yes, through the chair to the administration, is this a new position or an existing position that's being funded?
Through the chair, this grant has been in place for several years. It is not new.
I'm sorry, I didn't quite hear the end of it.
Oh, through the chair, this is not a new effort. This has been in place for several years.
So there's currently somebody in the position, that person that's reviewing the medical records. Is that a
Through
single?
the chair, that is correct.
And is that a single staff position or multiple people do the work or?
Through the chair, it's a combination. So there's an RN dedicated to this effort. We also have some clerical support as part of this to obtain the records, to do the coordination with New York State.
Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0373, amend the 2022 to 2027 capital improvement program to add a project entitled Implementation Support Services for Electronic Health Record System.
Madam Chair. Second.
Moved by legislator Marionetti, seconded by legislator Heber. Is there any discussion? Legislator Lamar?
Thank you, Madam Chair. Through you to the administration. Has this EHR system been used before?
Through the chair, we will be putting the EHR system out to bid. So I don't know which one we would choose. We are soliciting from bidders that have existing functioning EHRs. It won't be like a beta test.
Thank you.
Legislator Heber?
Thank you, Madam Chair. This electronic health record system, is it to support the entire county health department?
Through the chair, it supports a number of divisions, but there may be some that choose not to. So all of the nursing services divisions will be supported, all of the maternal child health. We're also looking at ways to support OMH. There's certain segments of that we can connect to. So but it doesn't support certain aspects of environmental health and restaurant inspections. So it's patient focused.
Through you, Madam Chair, to the administration, when is this being scheduled in the CIP year?
It's the 22 CIP.
Understood through you, Madam Chair, the administration, which year of the 2022 to 27 will this project be put in?
Through the chair, it will be put in the first year, 22.
Thank you, and that's it. Thank you, Madam Chair.
Legislator Hayes?
Yeah, I just want to, Legislator Hebert asked me a question on this tonight going on. Does this allow the departments within the Monroe County Health Department to talk to each other through the EHR, through each administration, excuse me?
Through the chair, yes, it does. It allows us, where we're sharing the same patient over a couple clinics, to have the ability to share the needed medical information back and forth.
Thank you, that's all. Any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0374, acceptance of a grant from the New York State Office for the Aging and authorize a contract with Lifespan of Greater Rochester Incorporated for the New York State Elder Abuse Education and Outreach Program.
Through you, Madam Chair.
Second.
Moved by legislator Hebert, seconded by legislator DeFlorio. Is there any discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0375, acceptance of a grant from the New York State Office for the Aging and authorization to contract with Lifespan of Greater Rochester Incorporated for year 2 of 3 of the 2020 to 2023 Lifespan Respite Care Program.
Move it, Madam Chair.
Second, Madam Chair.
Moved by legislator DeFlorio, seconded by legislator Colby. Is there any discussion? Legislator Heber.
Thank you, Madam Chair. One quick question through you to the administration. On the attachment or whatever you want to call it, I don't know what's different about COVID in the second year that leads to expectations of a 90% success rate when only 50.5% was achieved in year 1.
Chair, that was COVID related.
Madam Chair, was that a question? I'm not sure.
I'm sorry, through the chair, that was COVID related. On-site, in-person trainings were limited.
Thank you, Madam Chair.
Any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0376, acceptance of a grant from the New York State Office for the Aging and authorization to contract with Lifespan of Greater Rochester Incorporated for the 2021 to 2026 Lifespan Respite Care Program.
Move it, Madam Chair.
Second.
Moved by legislator Colby, seconded by legislator Marionetti. Is there any discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0377, authorize a contract with the University of Rochester Medical Center to provide ventilator and pediatric unit staffing at Monroe Community Hospital. Move it, Madam Chair.
Second.
Moved by legislator Marionetti, seconded by legislator Hebert. Is there any discussion?
Thank you, Legislator Langy. Thank you, Madam Chair. I'd just like to declare my interest.
Legislator Hebert.
Thank you, Madam Chair. One quick question through you to the administration. Why is year 1 $700,000 more expensive than years 2 to 5?
Excuse me, through the chair, the referral amount of $4.9 million covers a period of 14 months. The annualization of that is the 4.2. It covers the period 11/1/21 through 12/31/22.
Thank you. Thank you. It would be nice, but I don't. Oh, I see where it says that. Very good. Thank you.
Yes, legislator Flora.
Thank you. Through the chair to the administration, is this a new program that's being utilized at MCH, or is this supplementing existing staff, or?
Through the chair, the Monroe Community Hospital opened the ventilator pediatric unit in the fall of 2018. We have 20 ventilator beds and 5 pediatric beds, and their services are provided by the University of Rochester for staffing, pulmonologists, and various providers.
So through the chair to the administration, just for my clarity, so this is just a new contract essentially for the same services that are currently being provided?
Through the chair, that is correct.
Thank you.
Legislator Lamar.
Thank you. Through the chair to the administration, the entire $5 million will be going towards salaries?
Through the chair, that is correct.
Thank you. And through you, Madam Chair, will there be additional staff hired, or how many staff members will be hired, and how will they be chosen?
Through the chair, they're currently providing staffing at Monroe Community Hospital right now.
Thank you.
So through the chair, it's a continuation of our existing contract.
Thank you. So through you, Madam Chair, is this an increase?
Through the chair, there is a slight increase based on the increase in salaries and benefits from the University of Rochester.
Thank you. And what was the prior salary amount? You said a slight increase. What was the amount prior to this?
Through the chair, I don't have that information available, but we could provide that to you.
Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 21-0385, acceptance of a grant from the United States Department of Agricultural, Food, and Nutrition Services for the Supplemental Nutrition Assistance Program Process and Technology Improvement Grant.
Move it, Madam Chair.
Second.
Moved by legislator DeFlorida, seconded by legislator Colby. Is there any discussion? Legislator Noodleson?
Thank you, Madam Chairwoman. Through you to the administration, my understanding is this is for technology and interactive voice response system, and through you to the administration, I'm wondering if someone could just explain how this will benefit the participants of the SNAP program.
Good evening. Through the chair, can you repeat the question? Sorry, I was moving from the gallery over here.
Sure. Yeah, through the chair, my question was that this grant is for technology for an interactive voice response system. And I just wanted to hear a little more, if I could, about how this will benefit the participants of the SNAP program.
Absolutely. So through the chair, Denise Reed, I'm the Director of Financial Assistance at Monroe County DHS. And we have had the SNAP Process and Technology Improvement Grant a few times over the years. For the 2021 year, we were one of 7 programs selected across the country. And we proposed to install a interactive voice technology system on our SNAP customer service line, which is the 753-2740 number. You probably have heard from some of your constituents that it's very hard to get through on that line. We're serving about 60,000 SNAP households across the county, and the limitations of the phone system do not currently allow us to answer all of the calls that we receive each day on that line. So we are hoping that this IVR response system, which will be programmed to provide some automated case-specific information as callers call in and are able to be identified through an internal verification process. And they will be able to ask programmed questions, and it will be connected to some of our internal applications. So we have an appointment system. If a person is just calling to say, what time is my appointment? They don't have to wait on hold for 45 minutes to talk to a live person. The system will be able to read into our appointment system and report back to the person electronically the date and time of their appointment. So we have about 7 prompts that we hope to introduce on this IVR system. and anticipate that it will significantly cut down on our dropped calls and our call wait times on the 2740 line. Through the chair.
Thank you very much. And also through the chair, that sounds like a great improvement. And my final question would just be whether the grant pays for the total cost of the system.
Through the chair, yes. The grant will pay for the total cost of the system. And I'll just add that the USDA actually reached out to us and asked us to increase the grant request. And so we got even more money than we asked for. That will allow us to also hire a consultant to help us with the design and implementation of the program.
Thank you. Thank you, Madam Chair.
Through the chair.
Legislator Colby?
How many, through you, Mrs. Madam Chair, how many lines, I know what number you're talking about, but how many lines does that default to? Do you have staggered in that? In other words, how many phone calls can you handle at once? Currently.
So through the chair, I'm not an IS expert, but I do believe that our 2740 line is actually limited on the number of lines that we have available. I'm recalling that maybe we have 20 through any given time, at any given time that can call through on the line. So we get about 40,000 calls a month on the line, and we only answer about 50% of them at this time. Through the chair.
Through the chair, do you anticipate to help the service to the clients with this system? Do you anticipate adding some more phone lines to that basic number? So this, because it's going to take a while for people to get through the system because they got to listen, hit a button, then wait again. So is included in this grant is adding additional lines? Through you, Madam Chair.
Through the chair, sorry. I wasn't quite sure how to answer. So I guess the answer is I'm not sure through the chair. It is something that we'll have to explore with the vendor and with the consultant that we have. We hope that people do not just say representative, as we all might tend to do. We hope that people will listen to the prompts and will find it helpful and really cut down on their wait times because based on the research that we did in preparation for the grant, we do understand that a lot of the questions that people are calling to ask can be answered by this electronic system. So that's what we're hoping for through the chair.
Through the chair, to follow, I would hope that maybe you would add some lines because when people go through the prompting system, it's going to take them some time, just like that number. But my follow-up question is this going to be available 24 hours a day, or is it just is this phone prompting system just going to be available during regular business hours?
Through the chair, the phone system itself, we are anticipating it being open 24 hours a day. And of course, the option to connect to a live person will exist, but only during our 9 to 3 phone hours through the chair.
Thank you. Thank you, Madam Chair.
Legislator Lamar?
Thank you. Through you, Madam Chair, to the administration.
So they say, whatever that means.
On this IVR line or on this line, will consumers be able to connect with emergency assistance, for instance, after hour services? I know I heard you say that to speak to a live representative, it would only be between 9 and 3. I'm just thinking about the late night hours when emergency services are needed.
So through the chair, this line, people will access IVR only by calling the 2740 line, which is the SNAP line. Normally, people don't call this number for after hours. They would dial the regular after hours number, which is 442-1742. But if it's not one of the prompts on the IVR, it will direct the person either during office hours to connect to a live person or after hours to call back. So hopefully people will, follow those prompts. But we could think about, as we think of the design, making sure that people know the other options for after hours line. So thank you, through the chair.
Thank you.
Is there any other discussion? Being none, all those in favor signify by saying aye. Aye. Any opposed? Oh, you have carries. Are there any other matters to come before this committee? Okay, being none. The October 26th, 2021 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, November 23rd, 2021 at 5:30. Thank you.